Name.
Okay, so good morning and good morning to those online. We are doing vascular tumors. So, Shane, you want to start us off with what you see here?
Looks like there's a central vessel.
So there's one there and there's one here. So describe what you see there.
There's no real hobnailing. The center looks like a floating vascular space there.
And what's kind of sitting right in the middle there?
What's this?
So that's actually an eccrine duct.
Okay.
There. So what do you have? You know, why would you have an eccrine duct floating in the middle of a vessel?
Maybe you have
And there's a pre-existing vessel and collagen, and that all kind of is jutting out into this. There's another little pre-existing vessel jutting out into that space.
So if you're saying you have a little wrapping of the...
It's like you have a new vascular space wrapping around a pre-existing structure. And what would you call, if you had something jutting out into, say, an ocean like that, and you were to be able to stroll out onto it and watch the sunset? You might call that a promontory that you're strolling out onto.
So is this like early, well, it's about wrapping, I guess it's the patch.
So, you know, it looks like with these dilated, irregular staghorn vessels and promontory sign and vascular wrapping, it looks for all the world like patch KS. And in fact, here again, you have promontory signs with pre-existing vessels and ducts jutting out or appearing to float within an irregular, jagged structure. Same thing up here, little vessel there. But this is HHV8 negative. And it is on a young person's extremity, and it's a little bump, and then there's kind of a brown halo around it.
So it's like a targetoid.
So targetoid hemosiderotic or hobnailed hemangioma. And in fact, the first thing you said when you looked at it is, well, I don't see any hobnailed nuclei, so you were clearly thinking of that possibility, which is good. The hobnailed nuclei are often there, typically there. And in fact, you got a few here. See that little, that thing's jutting out into the vascular space right there? That's about as hobnail as you're going to get in this one. So there are some hobnailed nuclei. So hobnailed hemangioma or THH, vascular spaces high that are irregular can mimic lymphangioma, sort of like this one here. Kind of off the screen for those on. So up top here looks like lymphangioma, and then down below looks like Kaposi's, but it's HHV8 negative and is a important simulant of Kaposi's. Well done. And even though we all say Kaposi's, he pronounced his name Kapshi.
That hasn't gotten a lot of pub.
No, it hasn't. Hasn't gotten any traction whatsoever.
Keep trying.
That was like a self-declared name, right? It wasn't used.
It was a self-declared name. It was the name of the river that ran through his town. His name was Morris Cone.
I'm going to call them Morris tumors from now on.
But he named himself after the river that ran through his town. It's like people say, "Hey, Toledo, how you doing?" He became Kapshi because he was from. That's where he was from.
Oh, interesting.
Yeah.
People call me Nebraska.
Yeah, exactly. It's,
vascular tumor of
we do exactly the same thing. Okay, so Dan, what do you see here?
So, sort of a busy dermis, vascular structures. There is some hobnailing. like things going on.
Yeah, and are these large vessels, small vessels?
Small. So I mean, I was between microvenular versus hobnail.
Your differential would be, it does have a little bit of hobnailing, small vessels,
Could also
and
be-
yet it's not all dissecting between collagen like diffuse dermal angiomatosis. These are more rounded, discrete vessels, so it's actually pretty good for exactly what you said, microvascular hemangioma, or microvenular hemangioma is the name usually used. So microvenular, microvenular, depending how you want to say it, hemangioma is another benign tumor that can mimic KS because of the small size of the vessels, but HHV 8 negative.
So there's small slit-like crack spaces.
Small like spaces, and is it diffused throughout the dermis, or is it centered? Is it patchy?
It's patchy.
And is it centered around any pre-existing
It
structures?
does look like it's centered around pre-existing vessels. And
So that would be a pattern typical for,
KS.
absolutely typical for plaque KS, where you have a busy dermis and with slit-like vessels, and it's patchy and centered around pre-existing structures like the eccrine coil, the erector pili. So this absolutely is a dead ringer for plaque KS, except that it is negative for HHV8, and you can see how red the dermis is. It's from a baby, and it was a big tumor with a big subcutaneous component, and the child has a consumption coagulopathy.
So capaciform hemangioendothelioma.
Yes, so caposiform hemangioendothelioma that comes by its name pretty honestly, right? Because it's very caposiform in the way it looks, and yet you know it's not KS because, number one, it's a baby with consumption coagulopathy, and number two, it's negative for HHV8.
That appears.
That'd be like a Casamek.
So Kasabach-Merritt, exactly. So it's the major tumor associated with Kasabach-Merritt syndrome. So again, quick review. At scan, anyone looking at this slide should think of KS, and the reason they should think of KS is it's a busy dermis with erythrocytes in slit-like spaces, and it's patchy, and it's centered around pre-existing structures like the eccrine coil and erector pili. That's a typical appearance for KS, but you stain it, and it's HHV8 negative, and it's a baby with consumption coagulopathy, and so that makes it a caposiform hemangioendothelioma. So we're in the deep soft tissue.
Yeah. It's a big chunk with some small vessels, slits inside of it.
And if you look here, how would you characterize, if you had to characterize the cell type?
Yes, they look pretty spindly.
Okay, so it's, there are wide areas that are just spindle cells.
Yeah.
Do you know any kind of spindle cell hemangioma?
Well, there is that.
There is that, right? So there's spindle cell hemangioma. So tell me about spindle cell hemangiomas. What are they supposed to look like? And the old name is spindle cell hemangioendothelioma. Same
Right.
thing. Spindle cell hemangioma, spindle cell hemangioendothelioma, same thing.
In a hemangioperiocytoma, they are spindly, but they have more like clear space in them, basically. I mean, like, they're still a spindle.
So in a what used to be, what is now mainly solitary fibrous tumor. You have staghorn-like spaces in spindle cells. And spindle cell hemangioendothelioma. You were talking about hemangioparasitoma, or you're talking about...
That's what I thought.
Okay, so hemangioparasitomas, which are now, most of them are solitary fibrous tumor. You have a patternless pattern of spindle cells, and you have staghorn-like vascular spaces, correct. Here, instead of staghorn-like vascular spaces, it looks almost like lung. If the best lookalike, that looks like interstitial fibrosis in a lung, where all your alveolar septi are too thick, right? So lung-like areas, sometimes phlebolyths and spindle cell areas are what characterize spindle cell hemangioma, which is a benign vascular tumor that mimics nastier things. So, very good.
So definitely some lymphocytic infiltration, and then
So lymphocytic infiltrate.
it almost kind of looks like honeycombing of the dermis, but that's just more vacuolization, or
So the whole thing is nodular and diffuse in growth pattern, right? So you have nodules and you have diffuse areas. And then you commented on honeycombing, which are, I think you're talking about all those little round things, right? And all those little round spaces,
it's like intracellular.
they are little intracytoplasmic lumens. So you have 1 million little intracytoplasmic lumens. What's that characteristic of?
It's the epithelioid hemangioendothelioma.
That's the epithelioid hemangioendothelioma. And we just talked about spindle cell hemangioendothelioma is completely benign. How about these?
It's like low-grade sarcoma.
Like low-grade sarcoma, correct. So spindle cell hemangioendothelioma, nodular and diffuse proliferation of endothelial cells, characterized by these round intracytoplasmic vacuoles, and it behaves like a low-grade sarcoma. So absolutely correct. Very good.
Pretty dense dermal proliferation, kind of a central dilated vessel.
So if that's epidermis, do you think this is an endophytic or exophytic thing?
Exophytic.
So exophytic, and is the surface intact or the surface is crusted?
Crusted.
And you
That's quite a
commented
lot,
on a central dilated vessel, and then what are all of these connective tissue things dividing it into lobules?
Like hyalinization of the vessel.
Or like septi,
Or septic.
fibrous septi, there's one here.
It's like a pyogenic granuloma.
Like a pyogenic granuloma. So a pyogenic granuloma is an eruptive, lobular, capillary hemangioma that tends to erode and crust, right? So you can see this thing grew out like a mushroom. It's made of capillary-sized vessels. There's always a little feeder vessel. All pyogenic granulomas come from little traumatic arteriovenous malformations. So you get a little traumatic AVM, and then you grow a PG because of it. So you can usually see that little pumper of a vessel in the middle. And then you have the fibrous septi there and up here, dividing it into lobules. So it's an eruptive capillary hemangioma that's lobular that tends to erode and crust. So that's a pyogenic granuloma.
This one, lots and lots of little superficial kind of capillary-sized vessels.
And are the walls thin or are the walls thick and pink?
Thick and pink.
Why would they be so thick and pink? Maybe because it's been around a long, long time.
Yes.
So what's a little bump made of capillary vessels with thick hyalinized walls?
Just like a capillary malform.
Or like a cherry angioma. So cherry angioma, De Morgan spot that sits around for years and years, and the vessels become thick and hyalinized. So small vessels, but the walls are thick and hyalinized. That's characteristic.
Looks like a superficial dermal proliferation of small capillary-sized vessels.
And capillaries are usually round, right?
Mm-hmm.
Are these round?
Now they're more irregular,
Irregular?
slender.
Yep. Slender, irregular, jagged, any of those terms could. And in some areas, it's hard even to identify a vessel. It's more like just cracks in the dermis with large hyperchromatic nuclei in the lumen.
It's like angiosarc.
Like angiosarcoma. So angiosarcoma dissecting crack-like vascular spaces. You may or may not identify any blood in them, but you do have hyperchromatic hobnailed nuclei. So in the Hobnailed Hemangioma, you had hobnailed nuclei that were pretty much normal in size. These are big, ugly, hyperchromatic hobnailed nuclei in jagged, crack-like, irregular spaces in the dermis. So angiosarcoma. What else we got here?
Kind of busy dermis, some larger vessels maybe down deep, and superficial vessels, smaller vessels other than superficial.
So you got larger vessels, and tell me about the endothelium jutting into that vascular space.
Yeah, kind of like a hobnail-like pattern.
Kind of hobnail. So you have a central thick-walled vessel with a hobnail, just like that little feeder vessel you see in the middle of a pyogenic granuloma. But instead of growing a PG from the little AVM, this thing has lymphoid aggregates, and then what are those bright red things scattered in with the lymphs? So, do you know any kind of angiolymphoid hyperplasia with eosinophils?
I do, and it goes by such a name.
And it goes by such a name. So angiolymphoid hyperplasia with eosinophilia is, again, an AVM that gets fancy. So you have PGs are just fancy AVMs, and ALHE is a fancy AVM. You have that central thick hobnailed vessel, and then it grows little vessels, lymphoid aggregates with EOs. It tends to be sort of retroauricular. Your sister smacks you upside the side of the head. You create a little AVM there, and it grows those little nodules, right? And it's always your sister, by the way.
So this one has a busy dermis. Some of the cells look more kind of histiocytic admixed with lymphocytic infiltrate.
Yeah,
It's pretty diffuse in one cut.
agree. And then
So
any,
a lot of like periarctic debris, it looks like.
yeah, so why would there be clusters of neutrophils? And it's not like a pyogenic granuloma where the crust was on the surface. This is down in the heart of the thing. There are all these little clusters of neutrophils down in the middle.
They came out of the vessel and then broke up.
So any kind of vascular neoplasm that tends to do that, have those clusters of neutrophils down in its very heart and center, and the amphiphilic smudgy collections in where the
Like a vascular angiomatosis.
like bacillary angiomatosis, correct. So the clusters of neutrophils suggest that this is an infectious vascular neoplasm. And so the clue is you've got a capillary proliferation. It's not particularly lobular like a PG, but it's definitely a capillary proliferation in the dermis. And then all through it you have these little clusters of neutrophils. Like it's whispering, saying, I'm infectious, look at me, all these neutrophils, they're little pockets of pus, I'm infectious. And then there are the little amphiphilic areas, and those on silver stain, you can see the organism. And so this is, let's see, so this is a silver stain, and where those little clusters are, you can see that there are little coccobacilli there. And so BA is important because it tends to be a marker for yeah, HIV, exactly. So it's a opportunistic infection related to cat, various organisms related to cat scratch bacillus. Aphipia felis is in that group, Bartonella, Hensley. So they're all variants of Bartonellosis, basically, that in South America and the Andes causes Arroyo fever and Peruvian warts, which look like eruptive PGs all over you. And in the HIV population produces almost identical presentations. So the HIV patients look just like the people in the highlands of Peru look, with all those little bacillary lesions all over them.
So it looks like a large, basically just a large flebolith, and there's maybe some recanalization somewhere. I mean, I'd be favoring IPH. I haven't really seen the area yet.
The whole thing's a little confusing, right? There's a big clot there, and then towards
spindle cell hemangioma.
the periphery of the clot, you do have some crack-like spaces that look almost like angiosarcoma, but they're clearly at the edges of a big clotted vessel. And you know it's a vessel partly because you can see a big internal elastic here, right? See that big wavy internal elastic membrane? So you are correct that this is a variant of intravascular papillary endothelial hyperplasia.
So it's definitely vascular.
It's definitely vascular. And then what do you have at the lining the edges?
You have at least a double layer, some other places even thicker layer of kind of small pink cells that have very round nuclei. They look like gloma cells to me.
Yeah, they look like strings of black pearls.
And then there's a lot of vessels in this one, so this one's probably more of like a glomangioma.
Yeah, so those glomus cells, if it's a tumor of glomus cells, then it's a glomus tumor. If it has a lot of ang to it, then it's a glomangioma. Glomus tumors tend to be solitary and painful, and glomangiomas tend to be multiple, inherited, and painless. Okay. Let's pick up the pace here. What do you see?
Busy dermis, there are some crack-like.
Busy dermis, crack-like spaces. What are you thinking?
Something bad like that.
Something bad like an angiosarcoma, and you see the big hyperchromatic, ugly hobnail endothelium sticking into those crack-like as opposed to crap-like spaces. So, angiosarc, very good.
This has more of like a nodular capsule look to it, very
Like
spindly.
like a nodular KS. So it's a nodule composed of spindle cells and erythrocytes. Between those spindle cells, no identifiable vascular space. So that is a typical nodular KS.
Like a lymphangioma.
Like a lymphangioma, superficial, dilated, staghorn-like spaces filled with pink lymph. Let's see. Okay.
So you have a proliferation of vascular spaces, and some of which are like slit-like through the dermis.
So up above, they tend to be very large and staghorn. And down below, you have a patchy proliferation around the eccrine coil. So what are you thinking?
Is that the eccrine hemangioma or
The eccrine angiomatous hamartoma. Those vessels are more round, like hemangioma. Those are often painful, dusky, sweaty tumors in someone whose last name is Byler or something else, Pennsylvania Dutch. So they're almost 100% of them are from central Pennsylvania or rural Ohio where they're Amish. So, that's an Amish tumor, the eccrine angiomatous hamartoma. But here, the top is kind of staghorn, almost like a patch stage of Kaposi's. The deep part is patchy and wrapped around pre-existing eccrine coil like a plaque KS, but it's HHV8 negative and it's a solitary lesion. So tufted angiomas tend to be up in the dermis, high, whereas this is kind of deep, so more like a THH probably, targetoid hemosiderotic hemangioma, hobnailed hemangioma. Tufted angioma, we haven't looked at one of those yet. They tend to be on the shoulder of a young child, slowly progressive plaque. Okay, big or small?
Big.
So big and solid areas of endothelium. And then they turn into just sort of ordinary capillary-sized vessels.
Is this the endothelial, or excuse me, the epithelioid?
So the epithelial hemangioendothelioma tends to have little round intravascular spaces.
Oh, yeah.
When you look at it, you can see how red the collagen is and how small those collagen bundles are, so it looks like kid skin. Any kind of big vascular tumor that starts out as just sort of solid endothelial cells and then makes little round vessels in babies.
Just an infantile hemangioma.
Yeah, just like an infantile hemangioma. Any stain you might do that might help you with that?
Glute might be revealing.
So the GLUT1 might be revealing, as you said. So GLUT1 rich and niche tend to be GLUT1 negative. The regular infantile hemangioma is GLUT1 positive, just like placenta is. And there's still some body of evidence that they may actually be embolic placenta that just sets up housekeeping as a big hemangioma in kids. intriguing thought. Anyway.
Pretty dense vascular proliferation in the dermis. It's kind of, it's almost a colorative scale.
It's almost like a cholera.
It's not lobulated quite so much. A lot of eosinophils.
Lots of EOs.
So maybe
And then the endothelial cells are kind of big and histiocytoid. They look almost like histiocytes.
it's a histiocytoid ALHE.
So histiocytoid ALHE or histiocytoid hemangioma or epithelioid hemangioma, they're all names for the same thing. It's just an angiolymphoid hyperplasia with eosinophilia where your endothelium is histiocytoid or epithelioid. Very good.
Like a cherry angioma?
Yeah, but I don't see thick hyalinized walls. I see thick-walled vessel and very thin-walled vessels, like an AVM, arteriovenous malformation. Okay, let's see. What else is high yield here?
It's kind of got a glomus look right off the bat.
So you see blue cells, are they lining up like strings of pearls?
Not there.
Not so much. So what if they're actually lymphs?
Could think about LHE, but it doesn't seem to be
So like
aggregates as much.
ALHE, you'd expect an ALHE somewhere on step section to find kind of a thick-walled feeder vessel, and then it can be lobular like a pyogenic granuloma, and lymphocytes, and you'd expect some EOs in there, and this actually was an ALHE.
When they talk about the CEAN, cutaneous epithelial angiomatous nodule, is that part of the spectrum?
Yeah. So the angiomatous nodules are, and there's a plasma cell variant of. They're all variants of ALHE. Yeah. And when you were with Omar, he probably had lots of examples of those because he's done lots of that work. Okay.
So it looks like a busy dermis.
Like a busy dermis. And is it busy everywhere or is it busy in a patchy fashion?
More patchy.
And random patchy
And
or
pre-existing
around
structures.
pre-existing structures patchy?
Yeah, pre-existing structures.
So what do you think of when you see that?
So I'd stain it for HHV8.
And this one's positive.
So a Cohen's tumor or Kaposi.
You are correct. So cone sarcoma, or if you say, hey Toledo, hey Cleveland, wherever someone hails from, then it was Kaposi's sarcoma. So patchy around pre-existing structures. You've got these cleft-like spaces around the erector pili. You've got blood and busyness around eccrine coil. Is a clue to KS. Now, could a THH, targetoid hemosiderotic, mimic it? Sure it could, which is one of the reasons we get the HHV8 stain, because that'll tell you if it's KS or not. Big or small?
Very big.
Very big. And then the question is, okay big or not so good big?
Looks like not so good big.
Looks not so good big.
At all.
And then in the dermis, how would you describe these spaces? Are they well-defined, round, nice shapes?
Very ill-defined, jagged. Lots of hyperchromatic, irregular.
So what are you thinking?
Like angiosarcoma.
Angiosarcoma. So a big epithelioid, ugly angiosarc, but still some areas you can make out those crack-like spaces. Very good.
So this one has kind of separation and tufting around that area, but to me, what's standing out is the big kind of muscular arteries, which makes me think more like AVM.
Yeah, so thick and thin-walled vessels, probably AVM. Let's see.
Hemangioma.
Looks like a glomangioma. You have big ange, right? So you have big vessels, and at the edge of those vessels, you have strings of black pearls. So like a glomangioma. I think we're going to skip that and go on to a better example. Let's see. Okay, this is a good one.
So I think it looks more diffuse.
So it's a diffuse growth pattern. And why are all those little round circles in it?
Probably because this is a epithelioid hemangioendothelioma.
Probably because this is an epithelioid hemangioendothelioma, where you would expect in this diffuse nodular and diffuse tumor that those are little round intracytoplasmic lumens. So you can say lumens or lumina, but the latter sounds like a Chevy. So.
Lots of thrombi.
Yeah, and what's that big calcified pearl-like thing?
That's cut up.
Like a phlebolyth, exactly. So you got big old phlebolyth sitting in something that looks kind of like hemorrhagic lung.
So that's like a spindle cell.
Like a spindle cell hemangioendothelioma. So it looks like hemorrhagic lung, alveolar-like spaces. There's some solid spindle cell areas, and there are big old phlebolyths. That would be a spindle cell hemangioendothelioma, also known as spindle cell hemangioma, because it's the one in that group that's benign.
So that's sort of the AVM.
So thick and thin vessels, so arteriovenous malformation.
So there's a larger vessel, there's crack-like spaces, hemorrhage, almost looks like a nodular capices type of look too.
Like a nodular KS. So, definitely spindle cells and erythrocytes in between them, not in obvious vascular spaces. So any stain you want? And it was positive.
So you have a lot of vascular spaces, or just like through the dermis.
Yep.
You don't have a lot of capices probably.
And these are kind of crack-like spaces. So, getting an HHV8 is certainly reasonable. The other possibility is this fits somewhere in the spectrum of an angiosarcoma. When all of those retiform species look almost like reedy testis, the term retiform hemangioendothelioma has been used. It's a low-grade angiosarc. So whether you call it angiosarc or retiform hemangioendothelioma, you're talking about the same thing. So it's fine.
Angiokeratoma.
Angiokeratoma. So in angiokeratoma, those dilated vascular spaces are pressed right up into the dermal papillae, and there's overlying hyperkeratosis. So it's an angiokeratoma because of the overlying hyperkeratosis. And I have these on my fingers after chilblains.
Mabelli.
That's Mabelli type, and you can remember it. Just picture a little kid pointing, saying, "This is Mabelli." Right here is Mabelli. So he's pointing with his finger where he had chilblains. So that's the Mabelli type. And if you have them on your scrotum, Fordyce, does that tend to do anything bad to you?
Does something bad to the biopsy room resident?
Will square them, bleed out from them.
But this person has them not so much on the scrotum, but all over the shaft and suprapubic and sacral.
Could be a corpus diffusum of Mays and Hopf.
Corpus diffusum.
Pretty sure that's big.
sometimes referred to as Fabry's disease, which tends to be X-linked, lancinating pains in the extremities, renal failure. Very good.
I'm sure it is.
Okay, so what do you think, Steve?
Kind of has that same sort of vacuolated, like epithelioid hemangioma.
Yeah, it looks very much like an epithelioid hemangioendothelioma, nodular and diffuse tumor with all those little circles in it where you have intravascular lumen, right? So kind of deep.
It's like kind of a large central area.
Yeah. So deep staghorn-like thin-walled vessels, producing a deep swelling. Probably in med school saw pictures of, a big old swollen mass around someone's upper back or neck, like a cystic hygroma, which is a cavernous lymphangioma. Deep cavernous lymph vessels.
Central, but local, slit-like, thin wall vessels. Also debating if this is like partial or promontory sign like vessels or thin vessels.
Yeah, it looks kind of like a promontory, although it's like a big tuft sitting in a crescentic space. If that were in your kidney, what would you call it?
Glomeruloid.
Yes. So it looks like a glomerulus, and it has all of these degenerating erythrocytes in it that are sequestered within it. So are glomeruloid hemangiomas associated with anything? Poems, which stands for?
Oh, man. It's like polyendochronopathy,
So,
organomegaly.
so polyneuropathy, organomegaly, M protein, and skin changes, which are usually
They have skin.
hyperpigmentation, hypertrichosis, and yes, they do have skin. So, Poem syndrome, glomeruloid hemangioma, endothelioma.
So, maybe nodular fibrosis.
So you certainly have a vascular nodule. What are these things?
Neutrophils.
Yeah, why would there be clusters of neutrophils in a vascular tumor?
Vascular angiomatosis.
Like vascular angiomatosis. Very good. So in the U.S., usually a sign of HIV. In Peru, an endemic disease carried by biting flies that produces an acute febrile fatal fever that was called Arroyo fever. But people would also get these eruptive PG-like things, and a medical student named Carrion inoculated himself with a Peruvian wart, died of acute Arroyo fever, and became a national hero by proving that that they were one and the same disease, a acute febrile virulent form and a chronic bacillary angiomatosis form. So Carrion's disease or Arroyo fever or Verruga parwana, which is Peruvian warts, all the same thing and essentially the same as bacillary angiomatosis, just an endemic form. Okay, what do you see?
Sure. I see some hemosiderin.
Yeah, there's hemosiderin. And the hemosiderin's kind of not in the center, but at the periphery on both sides.
Right.
So it might have made a ring, like a targetoid hemosiderotic hemangioma. And then you look, and not surprisingly, a little bit of this hemosiderin is around the eccrine coil, like it's trying to form some kind of chronic vascular proliferation around pre-existing structures. And if you looked in step sections, you might find some dilated staghorn spaces up high, so it's a THH.
So this one's really kind of forming clumps around the eccrine coil.
It really is patchy and forming clumps around pre-existing structures, which first makes you think of...
At first want to get an HHV8.
So first stop is an HHV8, which in this one happens to be negative.
So then I want history.
Then you want history. And this is a chronic, slow-growing thing, and it has these cleft-like spaces, and they ended up calling it, went to a soft tissue person who called it a retiform hemangioendothelioma, basically low-grade angiosarc. But I agree, your first stop would have been an HHV8 for that tumor. Let's see.
So there's some dilated spaces, vascular spaces in the dermis.
And where do you...
That's all muscle.
That's muscle.
And so it could be a lymphatic malformation that's kind of deep, kind of getting in within skeletal muscle.
Yeah. If you just had these dilated, so an AVM given the thicker vessels, if you just had the thin-walled vessels, venous lake, some venous lakes may relate to a deeper AVM. Here you see pretty good thick-walled vessel. So a little AVM probably on a lip. Let's see what else we have here.
So there's definitely a vascular proliferation, both superficial and it looks like deep, and there's nodular lymphoid aggregates, which always raise my suspicion of something not good.
Yeah, and this is on the chest of someone who's had a mastectomy.
So I'm already at atypical vascular lesion, and I would want to know if she's had radiation, and if she has, I'd probably do a CMIC to make sure that it's not a radiation-induced angiosarc.
Which is exactly right. So women who are post-mastectomy would get these atypical vascular lesions on their arm and chest wall, which the soft tissue people chose to call atypical vascular lesion, AVL. And so an AVL is staghorn-like vessels growing on the arms or chest of someone usually with lymphedema and post-irradiation. And those that progress to malignancy and angiosarcoma tend to be after irradiation, and they upregulate CMYC, so that we use that either by immunohistochemistry or FISH to show that upregulation, because that says it's gone round the bend and is behaving malignant now, predictive of malignant behavior.
Some hemosiderin there around pre-existing structures.
So hemosiderin around pre-existing structures. Name 2 tumors that can do that.
Hobnailed Hemangioma.
So Hobnailed Hemangioma, which is the same as THH, targetoid hemosiderotic, and what else could do it?
You have like actual vascular wrapping. Like that.
Yeah, so KS could do it.
Mm-hmm.
So, you're going to want history and you're going to want an HHV8. But you see hemosiderin at scan around pre-existing vessels.
Very cellular with staghorn-like structures.
So what would they have called a cellular thing with staghorn-like structures back in the old days?
Hemangioparasitoma.
Hemangioparasitoma. And then these, the more spindly ones are solitary fibrous tumor. This one's not spindly at all. And this is one of the ones that the soft tissue guys even now still call hemangioparasitoma. They're not true. Hemangioparasitomas are not common, but they still occur.
KS, it's diffuse proliferations with some promontory signs.
So they're definitely promontory signs and around. Does KS usually have much endothelial atypia?
It does. So it's more angiosarchy.
So this is more angiosarc. So it's definitely a KS growth pattern, but with high-grade atypia. So, and remember, KS is a form of angiosarcoma, right? But this is going to be more like old man bruise angiosarcoma rather than old man on the leg KS because of the high-grade endothelial atypia. Is it lobular divided by septi, or is it more diffuse in the dermis?
It's lobulated divided by septi.
I'd go the other way around. I'd say, it's through the dermis instead of being discrete nodules with septi in between. And it's almost like an angiokeratoma up in the papillary dermis, but it goes deeper too, and it definitely has a verrucous surface. So do you know any kind of verrucous hemangioma? Yeah, verrucous hemangioma. Okay.
Just a bunch of slit-like spaces there that all think not a lot of red cells all through the collagen. Some nuclear atypia, it seems like to me. I would say think about patch KS.
So does patch KS tend to have a lot of nuclear atypia?
No, it's like some of the angiosarc.
So more like angiosarc, correct. So high-grade nuclear atypia or solar elastosis, those all might be hints that it's more angiosarcoma.
Nodular vascular proliferation, nodular KS, or it is a little lobulated, maybe. And
definitely around pre-existing structures, and this is an HIV patient and HHV8 positive.
The deeper dermis, pretty diffuse.
And what would you call this, where you have a vessel that's kind of sitting, floating, or jutting out like a promontory sign? So what would you think of? KS, and this is HHV8 positive. These are just very prominent promontory signs here in the dermis, the pre-existing vessels with stuff wrapped around them, jutting out into.
Can you see dwarf balls in that, or is that only a nodular?
Say it again.
Dwarf balls. Justin was telling us about dwarf balls and
Tell me
nodular
about
KS.
dwarf balls. Are those the are those the Highland glandules?
This is like, I don't know.
Oh,
You're
that's
talking about, like,
Okay, I'm not familiar with that name, but I love it.
Justin's been lying.
It sounds like like a name you would call someone you're mad at.
Yeah.
Dwarf ball. Yes.
Or you'd something you throw at your 5-year-old brother.
Or something you would throw at your that's pretty cool. So those are the degenerated erythrocyte hyaline globules that you see in KS in all forms, and you see in glomerular hemangioma. And I did not know that name. That's pretty cool.
the dwarf ball of Candy.
That one, well, I guess it's fair on this side. So
So I was between epithelioid hemangioma or PG.
yeah, you can, it's definitely nodular. And this one, it looks like there are fibrosepti. And the difference in something dissecting between collagen and fibrosepti is in the fibrosepti you have new ropey collagen, and it tends to be condensed into a strand. Right, so that one's pretty good for pyogenic granuloma. And I think that's it. We're out of time. Okay, well done.
So, like, if you want to see dwarf balls, I can show you.